Hi, I'm Margaret and Medina.
I'm Medina Saliu, and we're here to debunk popular myths about the coronavirus.
Is getting the coronavirus a death sentence? Based on available data, the coronavirus is a mild viral infection, and for now there is just a 2% fatality rate and 18 to 20% in a critical condition range, and those in the hospital still have a 98% chance of surviving, so it is not a death sentence.
It started in China, but it can spread everywhere. Infectious diseases do not respect boundaries.
African blood or black skin does not resist the coronavirus. There are reported cases of black people contracting the virus, one of which is King Udo, a 22-year-old Nigerian footballer who plays for an Italian team.
This is incorrect. There are other viruses with higher fatality rates. An example is the Ebola virus, which has a much higher fatality rate.
Only the respirator N95 mask has the capacity to protect you from the virus infection, and it is usually for health workers at the front line of combating the spread of this virus. The regular surgical mask that you see everyone wearing is unable to give 95% protection from particles that are airborne like the respirator does. So wearing a mask is usually for those who are infected so they don't infect other people.
This is unlikely because of the time it takes for packages to get from China. Even though the coronavirus is transferred from respiratory droplets, which can stay on surfaces for a couple of days, after a while the virus outside the host body will most likely die.
Travel bans during times like this have proven not to be very effective in the past. Instead, it caused more fear and chaos and made people afraid to come out to say they were ill. Non-essential travel, of course, should be restricted, but it is important to monitor the spread in the countries that have reported cases and take necessary precautions if you are to travel to those countries.
The virus affects everyone, including children. But older people are more likely to have severe disease, so older people have to take even more caution.
There are now 3 different coronaviruses known to cause disease in humans, which all belong to the same family. One of which is SARS, also MERS, which is the Middle East Respiratory Syndrome, and now the COVID-19, the popular coronavirus disease. SARS had a higher fatality rate of 10% compared to the coronavirus, which is now 2% fatality rate. So coronavirus is different from SARS, and it spreads more easily than SARS because it spreads like common flu, and the large numbers of infection doesn't necessarily translate to deaths.
Corona is Latin for crown, so the coronavirus is named that because it has a crown-like appearance. But the beer has absolutely nothing to do with the virus, and it would neither prevent coronavirus nor give it to you.
There hasn't yet been any reported cases of pets transmitting the virus to their owners.
The coronavirus could be due to climate change, ecological factors, agricultural factors, or even human behaviors. So it is still very unlikely that a human can be able to do that.
Viruses and bacteria are 2 different microbes, so antibiotics are used to fight bacteria and antiviral medications are used to fight viruses. So in this case, antibiotics can fight the virus.
There is currently no known medical cure or treatment of the coronavirus infection. Therefore, to stay safe, keep all precautionary measures, continue to get information about the virus through credible sources like the World Health Organization's website.
There is no need for fear or panic. The government has said it is taking necessary measures in curtailing the spread of the virus, and hopefully there will be a vaccine soon.
So now you know better. No need to scramble for masks because that doesn't protect you. No need to take your children out of school out of panic. Nigeria hasn't gotten to that level, and hopefully we will not.
And yeah, for the pharmacies and stores hiking the price of masks and sanitizers, please, you all need to chill.
Peace out, really. Oh my goodness.
That's how